Minimally invasive, cutting-edge spinal surgery technique being performed at a Sydney hospital is giving some elderly Australians a new lease on life. Sky News was granted a behind-the-scenes look at how an endoscopic laminectomy is performed and how patients are bouncing back quicker compared to traditional spinal surgery.
Georg Pedersen has long suffered back pain and it's worsened with age. 8 weeks ago, he had an endoscopic laminectomy and swears he's a new man.
I couldn't believe it when I woke up after the operation that there was absolutely no pain of any kind anywhere.
Known as Band-Aid back surgery, the procedure involves the surgeon making a small cut in a patient's back, allowing enough space for an endoscope, or a tiny camera with a light, to be inserted. Fluid is used to create a space for the surgeon to work. They use specialist tools to rapidly clear tissue and then a small drill to cut through the bone, creating a window known as a lamina. This allows the surgeon to access the spinal canal and locate the nerves they're trying to decompress or take the pressure off to alleviate pain.
The endoscopy has revolutionised women's surgery, abdominal surgery, prostate surgery. And we're now seeing that transition in spine. Most patients are pleasantly surprised. They have chatted with their friends, they've heard horror stories about many months of prolonged recovery, and they've had an intervention for which a week or two later they return and they say, you know, I didn't have much pain here and I'm back doing pretty much everything that I want to be doing and more.
Professor Mobbs has spearheaded the technique at the Prince of Wales Private Hospital, which began investing in the surgery about 4 years ago. He and his colleagues perform up to 15 of the operations each week, and surgeons across Australia travel to Randwick to soak up their knowledge.
When I first started training, it was not available in Australia. So it did involve travel to all around the world, Germany, South Korea, some other places to learn the technique. At the moment there's around about 10 surgeons across Australia. However, that number is increasing rapidly as the benefits are pretty obvious.
This surgery is commonly performed on elderly Australians. It's used to treat spinal stenosis, but also other problems like bulging discs, which can impact younger people. Having toured the world as a cellist, Georg is back enjoying his craft and his fitness.
Well, I can do everything I want now, you know, play the cello, walk, do everything. So it just gave me a new lease of life, yeah.
As well as travelling with wife Julia.
We have wonderful memories of having a holiday in Switzerland, so we are going back next year to the mountains and the valleys and climbing, and so it'll be normal life.
Any procedure has risks, and it's important that you consult a specialist who deals with the spine before making a decision on what's right for your problem.
Julia Bradley, Sky News, Sydney.